Mrs. Jones. I'm Madeline. I'll be your student nurse today. Can you please state your name and date of birth? Okay, I'm just going to check with her armband to make sure that matches, which it does. Okay, I'm going to go ahead and provide you with some privacy. So today I'm going to be inserting a Foley catheter. So I'm going to walk you through this entire process and make sure you are comfortable throughout the entire procedure as well. Okay, so to begin, can you tell me if you have any allergies to betadine or latex? No? Okay. Do you have any cultural or religious concerns you would like me to know about before we begin? No? Okay. So I will have the patient lie on her back with the knees bent. Okay, now I'm going to perform hand hygiene and put on my gloves. Okay, so I will cover her upper body and just exposing the lower part, and I will have her, like I said, lay on her back with the knees bent out. Okay, I will then start to clean the area. So to do this, I will take my washcloth and soap and just do one swipe each, and then use a clean washcloth for each wipe that I do. I'll then dispose of that. Okay, then I'm going to remove my gloves and perform hand hygiene. So I'm going to begin to set up my sterile field. So I set up my sterile field, and now I'm going to set up or put on my sterile gloves. And I'll make note that the 1-inch border is considered to be contaminated. So I'm going to start out by grabbing my glove with my non-dominant hand and making sure I only touch the inside of that cuff. I'll pull that down, and then I'm going to grab my other glove underneath the cuff and put that on. Okay, so now I'm going to set up the rest of my sterile field. Okay, so, and I will also set up the sterile pad underneath the patient with the shiny side down. Okay, so I'm going to put my forceps near the cotton balls, and then I am going to put iodine on those cotton balls. I'm then going to get my lubricant prepared, so I'll put that there so I can insert the Foley into there to lubricate that. Okay, so with my non-dominant hand, I'm going to grab the labia, and I'm going to start from the outer and wipe down and then dispose of that into the Foley bag, and then I will wipe inner or center, dispose of that, and then I will wipe closest to me, dispose of that, and I will dispose of the forceps as well. Okay, so now I am going to so now, so I'm going to get this ready, and I'll dispose of this into the bag, and then I will just let that lubricate. Okay, and I'll allow it to be lubricated for about 2 to 3 inches up. Okay, so now I'm going to insert the Foley catheter. So to do this, I am going to walk the patient through the procedure. Okay, so now I'm going to insert the Foley catheter. So to do this, I'm going to gently grab you right here so I can open the area up to insert the catheter. And also I'm going to have you bear down while I do this. Okay, so now I'm going to insert that catheter. Okay, just breathe, you're doing great. Okay, so I will insert that. Okay, so once that is inserted, I'm going to then grab the water that I will be inserting. Okay, and then I'm going to attach this and insert that water, okay, until the balloon fills up. Then I am going to gently tug on this to make sure that it is steady and inserted and that it will not come out. Okay, so once that is done, I'm going to remove my sterile gloves, and I'm going to perform hand hygiene. Then I'm going to put on a new pair of clean gloves. Okay, so I'm going to make sure that this catheter is taped into place. I'll also make sure the drainage bag is hanging on the side of the bed level to the bladder. I'm going to discard of my supplies into the trash area, and once again cleanse that perineal area, just one swipe each, and discard of that. Okay. Now I'm going to return you to a comfortable position, okay, and I'll move the bed to the lowest position as well. Okay, Mrs. Jones, that concludes the procedure. Is there anything I can do to make you comfortable before I leave, or anything that I can get for you? Okay, and I'll go ahead and put that call light by you, and then I'm going to take off my gloves, perform hand hygiene. I will also document the date and time of the catheter, the type of catheter inserted, the patency, urine quality, odor, patient's alertness and orientation during the procedure, abdominal assessment, skin assessment, patient and family teaching, and patient's response to the care. And that concludes the procedure.